Hey guys, welcome back to my channel. Today we're going to talk about how to do well on your surgery rotation. This is arguably one of the most difficult rotations in medical school. So let me give you an overview for how a day typically goes during a surgery rotation. A lot of it might be hospital dependent, but you generally come in around 5:30 in the morning or 6 a.m. and pre-round on your patients. Then you round with the team around 6:30 in the morning, and then there might be morning report at 7 a.m. After that, you prepare for whatever cases are scheduled throughout the day. You're going to attend your case or cases, and eventually there will be sign out and you get to go home. If you're on the trauma service, your schedule might be a little bit different because you can usually start your shift when the EM residents come in around 7 a.m. So you get to sleep in a little bit. During this rotation, you may be required to take 24-hour shifts. And during those shifts, you'll be responding only to emergencies that come into the ED that might require surgical intervention. If these emergencies do require surgery, you're definitely going to be expected to scrub into that surgery. So make sure that you get some sleep when you can. So let's talk about how to get great evaluations on your surgery rotation. So the first really good way to get good evaluations is to fill your pockets. When surgeons round every single day, they're going to be checking people's wounds and they're going to be getting rid of old bandages and have to put on new ones. So if you can have anything in your pockets that's handy, then that will look really great on you. So what sort of things do you need to carry with you in your pocket? It's great if you have some gauze pads, some tape, some Tegaderm, some Curlix, and sometimes suture removal kits will be really handy on those morning rounds. You're going to be expected to wear your white coat over your surgical scrubs the whole day long in order to keep them sterile. So this is the best place to keep those surgical equipment in your pockets. Also, don't get caught without your stethoscope, because if a surgeon ever needs to use it and you don't have it, that'll look really bad on you. During my surgical rotation, the clerkship director said, "A good medical student has 2 stethoscopes, one for themselves and one in case the surgeon forgets their stethoscope." I'm sorry, that's too funny. Another great way to get good evals is to have a really concise, clean presentation. Now, it's hard to say concise and clean when there are a lot of things that you need to put into this type of presentation that you wouldn't need in a different specialties presentation, but we'll go over that. So surgical rounds are usually performed outside the door to the patient's room or sometimes at the patient's bedside. And surgeons really only want to know what is relevant to the surgery that was performed in the hospital. So you want to mention how many days post-op the patient is, what type of wound the patient has post-surgery, and how that wound looked. You want to mention if the patient is on any antibiotics, any fluids the patient is on, or pressors that were started because of the surgery. And you want to mention any medications that may have been stopped because of the surgery and whether or not the patient should be put back on them. You also need to mention if the patient has any drains, which also includes Foley catheters, and how much fluid was put out from those drains. Especially if it's a drain at a surgical site, you need to describe the fluid. So was it purulent, which is really worrisome because that's pus, it's an indication of an infection. Was it sanguinous, which is also worrisome because it can be a sign that the patient is bleeding more than they should be bleeding. Is it serous, which is less worrisome because it's clear fluid and normal fluid that the body makes. Or is it serosanguinous, which is also not so concerning, but you definitely need to mention the amount as well. If the patient only has a bandage and no drain, you need to mention, was that bandage dry or was it wet when you went to go and examine the wound? They do want to hear about the past medical history of this patient, but they don't want to hear about it in too much depth because as surgeons, they won't be really changing the management to the patient's chronic conditions. In the end, you want to mention if the patient would be a good candidate to go home or if the patient needs to stay in the hospital. And if they need to stay in the hospital, do they need to stay on the surgical service or can they be transferred to the medical service in the general medicine floor to complete, the last few days of IV antibiotics or something like that. The next thing you can do to get great evals on your surgical rotation is to show interest and eagerness to participate in surgery. So whenever you're on a case, look interested while you're in the OR. Offer to help and try to anticipate what the surgeon or what the resident needs during the procedure. So this might be retracting further in order to increase the visual field of the surgical site, or trying to give them some gauze if it appears that they might need that. The best thing that you can do to get these good evals is to make sure that you read up on the surgery and on the patient prior to coming into the OR. You need to be prepared for those pimping questions that they might ask you during surgery, and you don't want to look unprepared. You can watch the procedure on YouTube beforehand so you kind of know what to expect and what it looks like, and you can review anatomy online or using your old anatomy textbooks. A lot of the questions that they normally ask during surgery have to do with anatomy, or it can do with post-surgical complications, or they can ask you, why are we doing this or that technique? After the surgery is over, you're going to stay with the patient until they're moved to the PACU. You cannot leave early. That will definitely look bad on you. So once the patient is in the PACU, then you're good. You can leave and you can go continue with whatever other activities you have to do for the rest of the day. So in this rotation, you learn relatively quickly whether or not you love being in the OR. So if you're one of those people like me who hates being in the OR, just take it one day at a time and honestly fake it till you make it. Surgeons really love to feel when other people are enthusiastic about surgery, because you wouldn't be going into surgery if you're not passionate about it. So if you can make it seem that you are interested in surgery, even if you're not, that'll definitely help your evals. The rotation will be over soon enough. So now we're going to talk about how to prepare for the shelf exam. So the first thing I'm going to say is get used to doing questions and flashcards in weird places, like standing up, doing them on your phone, doing them during rounds or while you're waiting for rounds to finish or for a surgery to start. Those UWorld surgery questions are kind of trash. Personally, I didn't think that they were that helpful in preparing for the shelf exam, but you still want to do them because there's only so many ways that a question can be asked about a specific topic. So you want to be aware of how can these questions be asked so that you're never surprised when you do see the same sort of topic asked in a different way. Just don't let those UWorld questions be the only thing that you do. This is the first time that I'm going to mention those NBME practice exam. So I would say that these are really important to use for the shelf exam. You can purchase them from the NBME website that we got those practice NBME exams from for step 1, but there might be some sources that have access to those old NBME exams for free. Try asking around to students who have already completed the surgery rotation or other students that are in the surgery rotation with you to see if anybody has the plug for those free NBMEs. These questions will prepare you a lot more than UWorld for the shelf exam, but just make sure you do both. And the last thing you can do to really prepare for that shelf exam is to make sure that you do Anki. It's a really good resource for that spaced repetition. And the last piece of advice, try to make good relationships or friends with other people in your rotation, because this is a rotation that you'll definitely need all the support you can get. Okay, good luck guys, and I hope this was helpful. See you in the next video. Bye!